Hi there, everyone. I'm going to give folks a minute or two to pop over from the waiting room. Thank you so much for joining us this morning. You see folks jumping in. Okay. Well, thank you so much, everyone, and good morning. I'm so glad to have all of you here. As you know, later this evening, President Trump will deliver a joint address to Congress, and there is no doubt that the president will spend much of his time tonight boasting about his administration's work to advance his dangerous policy agenda. What you won't hear from President Trump tonight is that abortion bans are killing women across the country, and if he gets his way, more women will die. The first month and a half of Trump's second term have been chock full of vicious new attacks on abortion rights and reproductive freedom, and Republicans in Congress want to go even further. Today, Free and Just is honored to be joined by Senator Patty Murray, former Congressman Colin Allred, and patients, providers, and advocates who attended last year's State of the Union as honored guests. We are here this morning to set the record straight and highlight what is really at stake for families across this country. With that, it is my pleasure to introduce Washington Senator Patty Murray. Senator Murray.
Well, thank you, Kelly, and everyone on this for joining us for this really important conversation. And I have to say, it is great to be reunited with Kayla, who was my guest to last year's State of the Union, where we joined together to underscore the devastation and cruelty caused by Republicans' extreme attack on abortion rights. Unfortunately, it is painfully clear today that we have to continue shining a harsh spotlight on this issue because while Trump and Republicans would no doubt love for all the chaos that they are causing to push these stories out of the public eye, today there are even more women suffering and, yes, dying because of Republicans' extreme abortion bans. And we will not stop pushing to make their stories heard and make change happen. This work is far from over, but I will never, ever go back down from this fight, especially now that Republicans are doing everything they can to push things for what is already nightmarishly bad to somehow even worse. The stories women have shared since abortion rights were stripped away have been horrific. Women forced to stay pregnant despite what they wanted, despite what was best for them, even despite medical emergencies. But the data also continues to roll in and give us an even clearer picture of the grim reality for women in this country. At the same time, we are finally making overdue progress nationally to actually lower maternal death rates. We are seeing maternal death rates surge in Texas and other states after Republicans put in place extreme abortion bans. What is the Trump administration doing now? Well, for starters, they've locked researchers out of a key maternal health database and fired people who were working on maternal health research. That is going to painfully undermine some of our best tools for understanding the damage that Republicans' extreme abortion bans are doing nationwide. But more than that, they've replaced anti-abortion dog whistles with anti-abortion train whistles, sending a clear signal to extreme and even dangerous anti-abortion crusaders to go wild. President Trump issued mass pardons of people who broke laws that keep patients receiving reproductive health care safe. And he made clear he will not punish people who break that law going forward. That is a chilling invitation to lawlessness. People blocking patients or barricading clinic entrances, making violent threats, all of which we have seen before, and all of which it's clear Trump wants to make even worse. And Trump is not just emboldening extremists, Trump is seeking to empower them as well. His pick to lead the CDC is the father of the Weldon Amendment, which gave the Trump administration free rein to withhold funds from states that seek to protect abortion access. Dave Weldon is someone who has radical anti-abortion views and a long history of peddling inflammatory and medically debunked anti-abortion rhetoric that puts the lives and health of women in danger. Meanwhile, Trump's HHS secretary, has made clear he is completely open to Republicans' bogus push to rip away access to medication abortion, something that would append the most common and most accessible form of abortion care, which hundreds of millions of women turn to each year, especially since the Dobbs decision. So it may be the early days of this administration. Unfortunately, it is not too early to see that they are hell bent on ripping away women's reproductive rights, and that we will need to fight tooth and nail to defend abortion access in this country from a new onslaught of Republican attacks. But women across the country are fed up with having their rights undermined, having their health jeopardized, and having the most personal decision stripped away from them by Republican politicians. They're going to continue to speak out. Women like Kayla, that you're going to hear from, continue to have the courage to tell their stories, and we so appreciate that. I'm going to continue to do everything I can to lift those stories up, make their stories heard in the halls of power, and to stand my ground in the fight to protect abortion access in America. So thank you all for doing this today. Kayla, I proudly turn it over to you. Thank you.
Thanks, Senator Murray. It's nice to see you again. It was an honor to be at the State of the Union last year to share my story about my son Brooks and how when we lived in the state of Idaho, it was 2 days after the trigger law went into effect. And so when we found out the devastating news that our son had several fatal fetal anomalies, there was nothing any of our physicians could do in the state of Idaho. So we felt like refugees having to leave and come to the state of Washington to get the care that we needed and very much deserved, to not only protect my life in the case that I potentially would get preeclampsia, which I had gotten with my oldest daughter, and then went on to also get with my youngest. And so I was able to connect with several women, incredible women that are also here with me today, and share our stories. So had horrific firsthand experiences with these similar issues with abortion bans. And they also understand how important it is to speak up, just like I did, and talk about the most horrific time in our lives so that other women did not have to suffer like we have. Within days of the Trump administration taking office, he had rescinded former President Biden's executive orders that protected reproductive health care. He wiped all information about these essential healthcare services from government websites, and he nominated a slew of anti-abortion extremists. Now, there are several Senate-confirmed officials with alarming anti-reproductive rights backgrounds, and it's horrifying. I am here today just to do my part to speak out on what is going on and also abortion care and how important abortion care is, and it's not black and white. And so I would also like to introduce former Congressman Allred.
Well, thank you, Caleb. That was so great. And thank you, Senator Murray, for being on. I'm so glad to be on with my friend, my fellow Texan, Amanda Zarowski, our recently Time Person of the Year, Amanda Zarowski. And to talk about this incredibly important issue for Texans. Listen, it's kind of a cliche, but I've had a lot of titles in my life. I've been a former NFL linebacker, a civil rights lawyer, an Obama appointee, a congressman. But the most important one is that I'm a dad. I'm a father to two young boys, and my oldest just turned 6. Our youngest is going to turn 4 this month. My boys were born in Texas, in a hospital 15 minutes away from the hospital I was born in Texas. And what we're experiencing in Texas is nothing short of a tragedy. I've talked about this quite a bit. We've had a 56% increase in our maternal mortality. We've seen cases of sepsis soar all across our state. We've had at least 2 documented cases of Texas women who were denied care when they were going through miscarriages and who died because of that. We were seeing OBGYNs fleeing our state, saying that they don't want to practice in our state, saying that they don't know how they can treat their patients. My guest at last year's State of the Union was Dr. Austin Denard, a good friend of mine. Grew up 10 minutes away from where I grew up in Dallas. She's an OBGYN herself. Her husband is an OBGYN. She noticed herself on her own ultrasound that there was a problem with her pregnancy, and she knew she had to flee her state to get the care that she needed. And she's become an advocate, and she can't join us today because she's still caring for her patients right now. And I know Dr. Bernard knows about that. And so I want to talk about this just really briefly from the perspective of a Texas father. And this is so important for men to talk about this. I have the distinction of being the first ever member of Congress to take paternity leave. I don't know, maybe something about being a former NFL linebacker makes it easier for me to talk about some of these things, but it's this incredibly important issue for men to talk about. That if you want to start a family, that the person you care about most in the world is going through one of the most difficult periods in terms of medical crises, that you want her to be able to get the care that she needs. And right now in Texas, this is not an uncommon phenomenon, and Amanda knows this is true. For us to meet a couple, to talk to a Texas couple, to hear that they're expecting, to congratulate them, and then for the next thing they say, for them to say that they're worried and that they're concerned, that if something goes wrong with their pregnancy, they don't know what they're going to do. A lot of our friends have the ability, oftentimes, to try and go somewhere else. Many Texans don't. Many Texans end up having a crisis. And some of them, like my friend Ryan, who found his wife bleeding out on their bathroom floor, have been turned away from one hospital and have to go to multiple hospitals before they can find someone who will care for them. And all of these issues that we've been having in Texas are getting worse under this administration and under their policies that are rolling back the few protections that we had under the Biden administration that were trying to make sure that at least emergency care would be provided to Texas women. I mean, I think that would be a basic idea, but now they're even rolling that back. And so it's before we even get to talks about cutting Medicaid and other issues, this is a crisis in Texas. I know there's a lot going on. I know that there's a lot that's happening to be concerned about, but this is an ongoing crisis. And for every Texan, for every American, we have to stand up and fight it. And so that's what I'm doing. That's what I'm going to continue to do. That's why I'm proud that Amanda is here telling her story, that I'm proud that Dr. Denard was going to join us but couldn't. And that's why I know that's so important that when we talk about the State of the Union has a crisis in the middle of it. And that crisis is that women all across this country are being denied basic health care, that families are being forced into impossible positions, and that for men, whether they're in Texas or across this country, this is a very real and substantive issue that we have to do something about. And so it's my honor to introduce Latoya Beasley. Ms. Beasley, we haven't got a chance to talk, but I'm incredibly proud of you for telling your story and thank you for being here.
Thank you. Thank you so much for that introduction. I do appreciate it. So like Congressman already said, I've worn a lot of titles in my lifetime. I'm a wife, I'm a social worker, I'm an advocate, but my greatest title has been mom. And last year I was a guest of Dr. Jill Biden at the State of the Union. My husband and I, we knew that we wanted to have a family. I got married pretty late in life, and we knew that we wanted to immediately start having a family. But we knew that it was going to come with some hurdles. So we started the process of undergoing IVF treatment, and we had our first daughter through IVF, Miss Lyric. And she's everything to us. She runs this household. She runs us and has us under her little finger. And so immediately when she turned one, we knew that we wanted to expand our family. So we started that process again. I actually had to stop nursing her, which was a hard task. And, so much so that we started 4 or 5 months out before our scheduled date to transfer our embryo. And I had gone through lots of tests, had kind of prepped my body. And a week before we were scheduled to undergo our embryo transfer for our second child, we were in the doctor's office when we learned that in the state of Alabama, we would have to stop our embryo transfer because essentially what happened was the courts said that embryos were people, so we would have to stop that, and that was a direct impact from Trump's abortion bans. And so like every other person in Alabama, I had to stop that embryo transfer. When you're dealing with infertility, every day, every minute feels like a lifetime. So, we didn't know what would happen. We didn't know, if we would be able to pick back up. But that kind of, ignited something in me that, we knew that because of the abortion bans, IVF could be affected, but we never thought that it could affect us. And I think that's kind of where we are right now, as a state, or everybody is there now. We heard about Project 2025, but people didn't think that things would happen to them, and so. Because of everything that happened to my family, and because our process to start our to expand our family was halted, I kind of started to advocate and tell my story, and just kind of let people know that this is what's happening. And even today, Trump has said that, he signed an order saying that he wants to expand IVF access to IVF, but it's just a lot of broken promises. There's nothing substantial behind that. Um, and so that is why I am here today, just to kind of warn and to continue to tell my story, and to try and get expand access to IVF care. And so with that, I will pass on to Dr. Caitlin Bernard.
Thank you so much. Thank you, everyone. It's really great hearing where we are kind of here now, 2 years later after Dobbs, and understanding really what's happened. As a physician, my highest priority, my deepest honor is to take care of my patients. And I feel like that has been broken in so many ways, and is only getting worse. Physicians are scared. We're scared to take care of our patients the way that we know how, the way that we are trained. Patients are scared. They're scared to ask their physician about abortion, which is a safe, evidence-based choice in a pregnancy, in any pregnancy. They're scared to come to them if they have complications in pregnancy. They have seen the stories of so many women across the country who have not received care when they needed it, and lost their life as a result, or have had long-term impacts. Physicians are scared of medical licensing boards, which have been used to come after physicians who speak out about the harms and injustices of abortion bans. Physicians are scared to lose their license. Imagine the idea that any person could accuse you of performing an illegal abortion, and your entire life and career would be destroyed, whether that was true or not. The idea that we are, bringing vigilantes into the patient-physician relationship, into the clinic room, is unconscionable. And we know what the results are. We told everyone before Dobbs that this is exactly what would happen. We knew that from the pre-Roe time. We have mentors who took care of patients who died before abortion was legal. I myself did. And we had heard the stories. We knew what was going to happen. And it's exactly what we're seeing. The question we have now is, what are we going to do about it? What are we going to do to reverse it now before it gets worse? How many people do we have to see on the news dying, taken away from their children, taken away from their families? And not just about abortion, but also about Medicaid. The fact that Medicaid covers almost half of deliveries in this country, and it's going to be cut. As you heard from others, physicians are leaving Texas. They're also leaving Indiana. Our maternal deserts are expanding. We had a woman die of an ectopic pregnancy in Indiana this year, completely preventable, should never have happened. But they weren't able to access the care, not clearly because of an abortion ban, but the downstream effects. This covers every part of reproductive health care. We've seen that with not having access to delivery, not having access to surgery, not having access to birth control. The question is, how much longer can we handle this? We're seeing increases in maternal mortality in Texas. That is really just the tip of the iceberg. Think about all of the women whose stories you've heard who didn't die, who are now unable to have a pregnancy, who suffered emotional and physical trauma because of what they went through. The deaths are just the tip of the iceberg. And as physicians, it's incredibly difficult to continue practicing in a state where we're seeing those injustices every single day, where we are in fear every single day to be able to practice, and where it's harder and harder for us to take care of our patients. And we'll just continue to see the physicians leaving. The challenge, of course, is where are we going to go? Right now, we have access to Illinois to be able to have our patients travel across state lines. We are very afraid that a continuation of the Trump administration means a national abortion ban. And then the question will be, where are people going to go? What is going to happen to everyone, the hundreds of thousands of people that are traveling now annually for abortions, and the risks that people are going to take, the less safe means that they're going to use to access abortion when they need it, and the complications that we'll see from that. So I think it's important to continue to speak out for people affected by abortion bans, patients, but also for physicians to stand up and be proud of the training that we have and the care that we need to be able to provide and want to be able to provide for our patients whenever and wherever they need it. So thank you for listening to us. Amanda Zarowski is going to speak next. I have the pleasure of getting to be with her this week in Indiana to represent her home state. So thank you.
Thanks, Dr. Bernard, and thanks everyone for being here and for having me. My name is Amanda Zarowski, and as Dr. Bernard said, I am originally from Indiana, but as my friend, the congressman mentioned, I currently live in Texas, where there's a near total abortion ban. And I experienced the cruelty of the ban in 2022 when I was denied an abortion as I miscarried my very much wanted baby girl at 18 weeks pregnant. I went into septic shock twice, which nearly killed me, and my reproductive organs and fertility remain permanently compromised as a result of what I went through. So like Latoria, my husband and I will now need to rely on IVF to expand our family, and we're terrified that that option will be taken away from us too. Since my trauma, the landscape for reproductive rights in this country has only gotten worse. We have seen restricted access to fertility treatments in states like Alabama. We have seen safe and effective medication used in abortion care and post-birth treatment classified as a controlled substance in states like Louisiana, restricting access in emergency cases. We've seen doctors in states like New York prosecuted for prescribing safe and effective medication. Most horrifically of all, we have seen women die as a result of being denied access to abortion care. These are just the stories we know of. There are so many more untold stories, just like the horrors that we do know of. So let me be clear. President Trump may claim that he's protecting women, but all his policies have done is harm us. As he will undoubtedly continue to enact policies that will kill women and devastate families, I, along with my fellow advocates, will continue to resist through the power of storytelling. I have traveled the country sharing my story, and time and again, I hear stories just like mine, oftentimes far worse, from families all across America. While we are devastated, we will not be defeated. As long as these inhumane bans exist, we will continue to fight back. So thank you for being here and for listening to us. With that, I'll turn it back to Kelly.
Thank you so much, Amanda, and thank you to everyone on the panel this morning and to all of the folks who are joining us on Zoom. If you would like to ask a question of folks on the panel, you can either raise your hand on Zoom to come off mute, or you can submit that question in writing using the Q&A or chat feature in Zoom at the bottom of your screen. So if you'd like to ask a question, feel free to raise your hand or submit that question in writing for the panel to be read out. And I do see a question coming in here, a question for the folks on the panel from Texas. How concerned are you about efforts to suppress information about the impact of the state's abortion ban? We know that following reporting from ProPublica, officials in Georgia dismissed all members of the state's maternal mortality review committee.
Yeah, well, listen, I'll take a first stab at it, and I want to let Amanda say whatever she'd like to say. The state of Texas has continually refused to study the impacts of its abortion ban, and the medical board in Texas should be ashamed of itself for its continuing denial of basic data, but also of issuing any kind of clarifications for physicians and for hospitals in terms of what they can do. This kind of gray area and this lack of solid data is contributing to this crisis, but also it's going to mean that every single day there's going to be something happening in a Texas hospital where the doctors are going to be talking to their lawyers, and the lawyers, not the doctors, are going to be making a determination about what's best for that patient. And that is, listen, I'm a lawyer. You don't want me making that decision, and I don't want to be making that decision, and this is not how it should be. And so this continued lack of access to the data has forced these outside organizations like ProPublica to come in and do these studies, to work backwards to try and understand stories like Nevaeh Crane and stories like Jocelyn Barnica, uh, women who died because they were denied care in Texas, had to work backwards to show that. We know that we have had a 56% increase in our maternal mortality, but we haven't always had the stories and the exact names and what happened. And we just know that there's going to be a continued effort, not only at the state level now, but at the federal level, to deny access to this basic data to talk about what's happening. We're already seeing that coming from the CDC. And I'm incredibly worried about what they're going to be doing just with health data in general, with a Secretary of Health and Human Services who's an anti-vaxxer who doesn't believe in public health. So this is a huge issue for us in Texas, but it's an issue for the entire country.
Amanda, did you want to weigh in on that question as well?
Yeah, I can add to that. I think Congressman answered it pretty well. I would just add that, this doesn't affect people just who live in states like Texas with near total abortion bans. This is a national crisis, and we are seeing restricted access to basic information. The government shut down reproductiverights.gov. They are censoring access to information on social media. And so we're in a real crisis here where people who are experiencing oftentimes a medical emergency can't get access to basic information to know how to help themselves. And if they can, they're terrified to do so because the penalties are so extreme that it's creating a chilling effect where people don't even want to Google how to access care. And that is going to lead to more harm, more chaos, and even more deaths.
Thank you both. And before we move on, Dr. Bernard, I want to give you an opportunity to weigh in on that question as a healthcare professional.
Yeah, absolutely. So maternal mortality review committees are an incredibly important way for us to understand what's happening in a state and at a national level around maternal mortality and also infant mortality. These affect their babies as well. And without that data, we cannot address the needs of people in our state. We cannot figure out what changes we need to make in our healthcare systems to be able to prevent these deaths. I think it's incredibly telling. If abortion bans weren't causing maternal mortality, then there's absolutely no reason that we shouldn't be able to do the studies and understand what is happening and exonerate them if that's what it is needed. But that's not what's happening. Abortion bans are killing people, and their purpose is to silence us and silence patients and physicians.
Thank you so much, Dr. Bernard, for weighing in there. I do see another question coming in for Latoria and some of the other folks who joined the State of the Union last year as guests. The question is asking, if you had an opportunity to speak directly to the president, what would you like to tell him? Latoria, do you want to start with that question? I know it's a big one.
Yeah, so I don't think that I would have a whole lot to say, to be honest. But if I did, I would I would ask more questions, and it would be, you've stated that you are the father of IVF, and I want to know what that means. What does that actually look like to you? Because yeah, that I would want to know what that means. And then also, this executive order that was just signed, like I said when I was speaking earlier, we know that, you know, there's no policy changes in this executive order. Nothing is set in place. So I would like to know, like, what does this order actually look like for you? What are you hoping to accomplish? And we know that President Trump has denied Project 2025, but we are seeing it being played out every day. And so, I know that in Project 2025, really the goal is to make IVF obsolete and to declare embryos personhood. So I would have more questions, not necessarily wanting to talk to President Trump, but I would have questions that I would like answers to.
Yeah, absolutely. Absolutely. Kayla, did you want to weigh in on that question there?
Yeah, loaded question. I agree with Latoya, though. I think I would just have a lot of questions. Like, what, again, he denied Project 2025, yet we are seeing the repercussions of exactly what was written every single day. And I guess I would just want to know, what was the point of him, erasing all of this information, from the CDC website, like about women's health care? Like, what is the end result of that, right? Like, what was he thinking in that process, I guess? So
Yeah, absolutely. Dr. Bernard and Amanda, I'm gonna jump in there.
Sure. I like the idea of questions because that's really what it is. How are you going to keep women safe? How are you going to address our concerns about the criminalization of pregnancy for people, for physicians trying to take care of our patients? We need answers and we need action. And destroying the basis for health insurance for millions of Americans is not a step in the right direction. Continued persecution of physicians is not a step in the right direction. And how are we going to turn the tide?
Yeah, absolutely. Amanda, one last opportunity if you had a chance to address the president directly.
Sure. I think first off, I would share my story and the story of so many others because we know that that's what really opens people's hearts and minds to changing their opinion on some of these things. And then I think I would ask him very directly if his daughter was in the situation that I was in, and if she went through what I went through, would he be okay with that? Because that's what's happening as a result of the policies that he supports. And then I think I'd like to end by just letting him know that, he can try to beat us down all he wants, but we're not going anywhere. We will not be defeated. We will not give up. We have not given up hope. And as long as he continues to try to restrict our rights, we will continue to fight back.
Thank you so much, Amanda. I think that's a really wonderful note to end on here. Well, thank you so much, everyone. I'm really grateful for your time today, and please keep an eye out for a post-event release with a link to this recording and my contact information for follow-ups. And again, Senator Murray, former Congressman Allred, and each of the storytellers here today, thank you so much for your continued work in this space, and we are so grateful. Thank you.
Thank you. Thank you
Thank you,
for bringing
everyone.
that
Have a
light
lovely
on.
day. Thank you.